For the future, our vision is a community where people have access to healthcare, to primary healthcare. Everyone has access to primary care, and where people knows their rights and duties.
The rights and
duties.
And duties.
Duties. This is our vision, general. But our future plans are numerous. In our program Action for Health, we want to increase the number of children that have access to free care for our project. And in the radio program, we want to sign other contracts with other radio stations so that the listenership can increase. Yeah, those are our planning for 2012.
For 2012.
For 2012, we want to expand the number of children who receive free care for import, and we also want to, as I told you, to increase the number of listenership of our radio. And we also want to expand our program to other slum communities next to Siko and Swahili. These are our plans.
Has the local government or Malian government taken notice of the project, or have they been involved at all, or no, not?
Yeah, the Malian government has been involved, especially when we were planning to build an Islam clinic. I don't know if you learned about the clinic.
I've read about the clinic, yes.
Yeah. So the government was involved. The plan was that the government will pay 25% of the total amount to build the community. So they were involved. And everything we do now with the clinic, with health, the Ministry of Health, they are involved and we work together.
And in terms of, you said that one of the big problems is money and fundraising. Do you expect that you can get more money from the government, or do you think this is a difficult issue? Because the ideal solution would be, or at least this is me thinking, would be if the community or the local government or Malian government can support this, so it becomes something sustainable for the future. Because it's hard to, I know it's difficult to depend on donations coming from different places.
It's difficult, that's true. But in the past, we tried to have funds from local government or national government, but it was really hard because, as you know, Mali is everyone knows that it's among the poorest countries in the world. So all the funds they have are invested in their own programs. So most of the time they don't have money for NGOs. You understand? But for logistical problems, they can act. Do you understand what I mean?
Yeah. So if you're having a problem with getting access to land to build something, or something like that.
Exactly. If we have problems, for example, when we're about to build the clinic, and we face many problems because sometimes people, the land that was reserved to build the clinic, some people thought that this land was theirs. So when we came, there was a problem. So we went to a local mayor office, and the problem was fixed. In anything we do, the government involved, but not in terms of finances. Most of the time, it's very difficult to get finances from the local government.
So it's logistical support.
Logistical support, but not financial.
Okay.
Most of the time.
One last thing, just to get your personal thoughts on. You mentioned, Malian Health Ministry, they have their own programs they run, and how do you think the program here, Mali Health Organizing Project, compares to some of the projects being undertaken by Malian Health Ministry?
Okay. I think the work that the Mali Health Ministry is doing is good. But what we are doing here, our models, I think it's better because we involve locals in the project we want to do. We involve them in the making of that. But the Malian government, they just come with their own ideas. They will say, we want to do that, we want to do that. And after a few months, they will see that, no, this is not possible in these cases or in this locality. I think it's always better to come in a community, to do some surveys, to ask people needs, and and then try to do something that will fit with their needs.
That's appropriate for that situation.
Yeah, that's appropriate for the situation. That's what I'm hoping.
Yeah,
and we want to expand this example or this model everywhere in